Thank you, Professor Balasurya. Good afternoon to you all. It's my pleasure to introduce Dr. Jayarathna, currently attached to the Adolescent and Youth Health Unit, Family Health Bureau, Ministry of Health. She is a postgraduate trainee, registrar in community medicine. She obtained a MBBS degree from the Faculty of Medicine, Ruhuna, in 2012, and she has had 2.5 years of experience in public health. She has also been a medical officer of health in Deranegala in the Kagala district. She has completed her community medicine master's in 2019. She now works at the Family Health Bureau as a national level focal point for maternal and child health and is responsible for planning, coordinating, monitoring, and evaluating the reproductive, maternal and child health and adolescent health programs in Sri Lanka. And her topic today is on male involvement in family planning in a rural setting in Sri Lanka. Over to you, Dr. Jayarathna.
Good evening, everyone. So, I'm Dr. Nadika Jayarathna. So, my topic is male involvement in family planning in a rural setting in Sri Lanka. So, family planning is a decision within the family where both the partners contribute. But traditionally, it is considered mostly a women's affair. But men also should be considered as equal partners in reproductive health. So, what is meant by male involvement? It is that they are as clients in family planning services, partners in decision making, and their supportive role for the partners' use of family planning, and finally as change agents for a better reproductive health care and gender equity. So, this male involvement is influenced by their knowledge, attitude, and perceptions towards contraception, and it eventually helps achieving high contraceptive prevalence rate as well. So, in Sri Lanka, though we have a high contraceptive prevalence rate, it has been stagnant over the past years, and services are considered as mostly female oriented. So, lack of communication strategies to reach men. There's less data related to male involvement in family planning as well. Okay, the methodology is the sampling method is a multi-stage cluster sampling method. There were 16 clusters. One PHM area was considered as one cluster. So the first household was selected by single random method. Then the other houses are selected by stratified sampling method. So the pre-tested interview administered questionnaire was used. Interviews carried out in the households of the participants. So these are the socio-demographic characteristics of the sample. Among the participants, their mean age was 32.7 years. Majority were Sinhalese. There were 19.4 Tamils and 83.3 from rural areas, and others were from the estate areas. Regarding their employment, all were employed and from extended families. And then majority of male spouses, 99.2, had, when we inquire about their knowledge on family planning, so majority of the male spouses, 99.2 of them, had ever heard of family planning, and the mean number of contraceptive methods known by a male spouse was 2.5, and there were 52.5% of participants who knew more than 3 methods. So benefits of family planning methods as mentioned by the study participants. So when we inquire them about what are the benefits of family planning method, high percentage of them, 53.8 mentioned about maintaining adequate gap between pregnancies. Another 35.7 mentioned about limiting the number of children in the family. 35.5 mentioned about preventing unwanted pregnancies. 18.5 mentioned about deciding the correct time to have children. Here multiple responses were allowed. And then their knowledge about different methods. Highest percentage was recorded for male condoms, 92.4. 65.3 of them were aware about oral contraceptive pills. 32.6% aware about hormonal implants, and 17.6 about the injectables. The least awareness was about female condoms. And when we asked about their knowledge on various aspects related to family planning, so when we asked about do they know about family planning services are being freely provided in Sri Lanka, 74.8% of them knew that it's been freely provided. There were like 65.4 who believed that family planning practices cause infertility. When we inquired them about that can missing oral contraceptive pills result in pregnancy, 70.8 of them thought can happen, and there were 29.2 who thought thought it's not possible. About legalization of abortion, so there were like 72.3 thought it is legalized. And then regarding the using of condoms and prevention of STIs, so only 41.4% of them knew that it can prevent sexually transmitted infection. And about the possibility of getting pregnant while breastfeeding, initial 6 months, so only 10.8% knew about, and there were like 56.8 who thought they can use emergency contraceptive pills as a regular method. So in the overall assessment of knowledge, 33.1 study participants had satisfactory knowledge on family planning. Majority 66.9 had unsatisfactory knowledge on family planning. And then we assessed about their practices. So among the male spouses, 15.4 were currently practicing any method. So out of male spouses, majority like 79.4 were using condoms and 19% were using natural or traditional methods. Regarding the attitudes, 83.8 approved using family planning methods by male spouses, 75.4 approved female spouses using family planning methods. The commonest reason for not approving family planning was the fear of side effects. And then the major concern was about the subfertility or the infertility. 20.3% believed it can cause subfertility. 78.6 agreed that male participation is important in family planning, but only 39.2% had a favorable attitude towards males attending family planning clinics with their spouses. In the overall assessment of the attitude, unlike the knowledge aspect, 56.9% had favorable attitudes towards family planning. Only 43.1 had unfavorable attitude. So there was a difference between this knowledge aspect and the attitude. And then regarding the decision making related to family planning, here we assessed about, we had a questionnaire assessing whether they discussed about this family planning with their spouses, when they first discussed about this, and when accepting the method, do they discuss with each other, and whether the male partner attended the clinic with the female spouse. Those things we assessed. 64.7% of male spouses had a good involvement in family planning decision making. High percentage, 92.2, had discussed family planning methods with their spouse. Out of those, 44.3 had discussed it for the first time after their marriage, and another 44.3 after having the first child. Here are the associated factors with the male partner's involvement in family planning: the residence, ethnicity, age, monthly income, age at marriage, and duration married, and especially the knowledge on family planning had a significant association with their involvement in family planning decision making. So the conclusion is that high percentage had unsatisfactory overall knowledge on family planning, but they had a high percentage had a favorable attitude towards family planning and had good involvement in decision making related to family planning. So the recommendations are increasing the participation of males during our family planning programs, incorporate men as an integral part of the target audience during health education sessions, and public health midwives to convey the messages during their home visits, and encourage male spouses clinic attendance with their female spouses, including both the partners during family planning counseling sessions. Thank you very much.